is Nick Allen. I'm the co-owner of Banbury Postiche and chairman of the HBSA Wig Makers. Banbury Postiche has been manufacturing wigs and hair loss solutions for over 100 years, and I've been with the company over 20 years. I'm also joined by by Neil Harvey, who is a current director of the Institute of Trichologists and practicing associate of the Academy of Experts and Institute Certified Trichologists. That's a big mouthful there, isn't it? You're very well qualified then.
Well done, you did well.
I've spent some time with Neil recently, and we spoke about the impact of COVID-19 on hair loss, and the patients we see here and the patients he sees in his clinic. And I thought it might be a good idea to share some information with people of how they can sort of deal with it and spot it, and hopefully make a difference to people that they're seeing in salon. So I think we all know the main symptoms of COVID, the cough, the temperature, the loss of taste or smell. But I suppose what's less well known, Neil, is how that can affect hair and hair loss. So I've got a few questions that we will go through, and I invite any questions in the chat at the end, and we can go through them. But a simple one then, Neil, is how do you define hair loss? Be the first starting point.
That's a really, really great question, actually. Very interesting. Generally, for me, and I'll keep it simple because I like to keep things simple. When someone contacts our clinic and is worried about their hair getting thinner in any way whatsoever, then that's hair loss. And if there's less hair there today than there was yesterday, as far as I'm concerned, that's hair loss. And we take it from there.
Okay, great. I mean, obviously you would lose some hair naturally, but you wouldn't perhaps notice that, would you?
To some degree, every single one of us, let's say over the age of 25, you could say we've all got thinning hair, because we can all say we haven't got as thick a hair as when we were 20. And that happens. It's a gradual process throughout our life. However, not all of us end up with a noticeable worrying thinness to our hair. It becomes a problem for some people when they do.
Okay, great. Thank you for that. What could be the causes of an increase in people who have had COVID-19 reporting hair loss, do you think?
Again, great question. Currently, no published research exists to suggest that COVID-19 actually attacks hair follicles. However, as we know, fever is a common symptom of COVID-19. 3 to 4 months after having a high fever or an illness, many people do experience noticeable hair loss. This can be as dramatic as handfuls of hair coming out when you shower or brush your hair, and can last for 6 to 9 months before it stops and a gradual recovery process begins.
So it's not an instantaneous thing. This can come out later, can't it? Well after you've sort of the first symptoms have gone.
Yeah, quite often we're actually feeling better, we're on the mend, and we've sort of almost forgotten about that period of illness, almost. We're hopeful, we're feeling good, and then this sort of secondary thing starts to happen. When we have a shower, when we brush our hair, why is this happening? And quite often a lot of people don't relate what's happening now with their hair to what was happening 3, 4, 5, 6 months previously.
So that's a good thing to know then. That's that could be related to something quite in the past, as it were. Stress, I suppose, going through COVID-19 is a stressful thing. That impacts one of the causes on hair loss, stress.
Yeah, we see it a lot in the clinic, and personally, I always feel a little patronising when I advise people to de-stress. But it really can be the beginning of a complex cause and effect relationship. So stress can impact your hormone levels. The adrenal glands produce cortisol and adrenaline, and that raises the testosterone levels. And if you have a genetic predisposition to follicle sensitivity, this can cause your hair to thin. The body's ability to digest foods and absorb nutrients can also be affected by stress, as can your immune system, leaving you susceptible to illness. So when your body is under this much strain, it will divert energy to your vital organs, bypassing the energy it needs for healthy hair growth.
Okay, brilliant. Thank you for that. So the COVID-19 thing obviously affects everyone, young and old. Have you seen any gender or age range that seems to affect more?
The term for hair loss that we explained a moment ago through COVID-19 related to the fever and the stress element is telogen effluvium. And there's two forms of this. There's acute and chronic. The acute form, which is a sort of short, sharp shock that may occur after a physical or emotional trauma, can affect any age group, any gender, any hair type, and any ethnic background. The chronic form, which is something that can last for 6, 9 months or years, in fact, usually affects women between the age of 30 to 60. And they generally have, a good head of hair before this happens. I use the word generally there because in our clinic, we do see people who are exceptions to these textbook rules.
Sure. Yeah, okay, brilliant. Is there a type of hair that's more likely to be affected? Or again, is it across the board?
It is across the board, but I suppose I'd say, obviously if you've got fine hair to begin with, then unfortunately you'll probably notice the effects of thinning and loss, perhaps more than somebody with a very thick head of hair who can perhaps afford to lose a little bit to begin with. But also, if you've got hair follicles that are sensitive to hormonal changes and stress, then you're starting with a disadvantage.
Is fine hair weaker than thick hair? Or is it, from a follicle point of view, does it not matter?
Good question. I'm going to go with it doesn't matter. Okay. I think it would be more fine hair because it doesn't have the bulk in layer upon layer that thicker hair, and we're talking about the diameter of each hair strand. So the finer hair strands will probably be more susceptible to damage, so blow drying and colouring. So you have to treat them a little bit more carefully, whereas if you've got thicker layers of bulk to your hair, the diameter of hair strand, that can usually put up with a little bit more external stress.
Okay, great. Cool, brilliant, thank you. Is there anything we can do? I mean, you've had COVID-19, say. Is there anything you could do in that period after that may help you not to lose your hair or go through a trauma? Is there anything you think you can do?
Well, let me say from the outset, the most important thing, because generally this form of hair loss is temporary, is not to worry. But I know that can sound a lot easier said than done.
Well, you get me worried now. I had it about 3 months ago.
Well, I haven't seen you face to face, but on this virtual consultation, you're looking good, Nick.
Thank you.
For people in general, if they're worried about hair loss after COVID, it would be really useful to consult a trichologist to confirm the diagnosis. It's better to know exactly what you're dealing with. In some cases, once the diagnosis has been confirmed, then actually nothing might need to be done to combat the issue. The trichologist may already see signs of active regrowth and just be able to reassure you that you are in a recovery mode. However, if somebody wants to be proactive in taking control of the issue, or if you've got the misfortune of having the chronic form of it, then a trichologist may have some treatments that you can recommend, such as dietary or lifestyle changes, supplementation or medications, obviously the latter needs to be discussed with your GP, or topical solutions or laser phototherapy that can help stimulate cell production and give the emerging hair the best chance for healthy hair growth.
Brilliant. That's some really good advice there. Thank you. What might hairdressers notice with their clients? Is it as simple as, you know, a little bit more hair loss than normal that they'd expect?
The short answer is yes. Definitely, that is a big clue. The warning signs are, I think first and foremost, it will be a client sitting in their chair that actually confides in them that they're worried about their hair getting thinner. If they're saying that, then by all means listen to what they're saying. The hairdresser may notice things like a lot of shorter hair in amongst the longer hair lengths.
Oh, right.
Looks like broken hair.
Yeah.
But may be indicative of hair shedding and new hair growing through. Obviously, over and above that, a receding hairline, receding temples, thinner hair on the crown or the entire top of the head, wispy ends on the length of someone's hair, a client whose hair doesn't seem to grow past a certain length, hair that's easily broken, some odd ones, hair that smells odd.
Oh, right, okay.
Yeah.
Smell can be a factor then.
It can be if you're picking up a certain smell and that person hasn't just changed to a weird and wonderful shampoo. It could be indicative of something happening within the hair shaft or within the person, an illness. Someone's eyebrows that are getting shorter. So if they're starting to lose the eyebrows here, that could be indicative of a hair loss symptom. An oily or flaky or dry scalp, pink or red patches on the scalp, someone who mentions that their nails are brittle or easily breaking, and maybe even someone with either sudden weight loss or sudden weight gain. These are all signs that may make the hairdresser want to look again a little closer at the person's hair to see if they notice anything different about their hair today than the previous 6 weeks or few months.
Yeah. Oh, that's really useful information. I'm sure hairdressers will find that really helpful. Obviously, it's a delicate area sometimes to broach when the client's sitting in the chair. Have you got any advice on how to sort of broach the subject with them if they're looking at the scalp and thinking, oh my God, there's something going on here?
Well, obviously, as you're saying, the reason we brought this subject up is it is a sensitive question, obviously. Hairdressers always need to remember to use terms, if the client started to discuss it with them, always refer to it as thinning hair or hair loss. Never use the bold or balding word. It seems to be popular in America. We don't use it so much over here. If it's a new client, it's going to be even more challenging to bring it up with them. I don't think I would recommend raising the subject with a new client, but you can ask, are there any concerns, anything you dislike about your hair? Ask, tell me what you like and what you dislike about your hair. Always start with the positive form of that question. If they don't say anything about their hair thinning, then it's okay. You don't have to bring it up. If your client says, oh, I wish I had thicker hair or more hair, that's your chance to say, as a hairdresser, I've got some tips about how to make your hair look thicker.
Great.
Just to go on. The next point on that, though, Nick, because this next point I want to really stress. If during the conversation it does come to light that they're generally worried about their hair getting thinner, then as a professional hairstylist, I would encourage you to have strong links with a well-regarded professional trichologist in your area. Refer your client to them. And what I want to stress is, don't try to offer any tips of your own to combat hair loss. I've seen so many online forums where someone's posted about worried about thinning hair, and 50 people have given 50 different tips on how to combat it.
Yeah.
And they're all different to one another. And it's going to take a long time to try 50 different tips.
Absolutely. Absolutely. That's really good advice. And even here, obviously, at Banbury Postiche, we see a lot of people with hair loss, and we are obviously affiliated to yourself and other trichologists, and we always, point them in that direction. We don't ever really try and solve them the issue ourselves. So that's really good advice. Obviously, it may not just be COVID that we could be talking about. There's alopecia sufferers, people going through chemotherapy. Again, have you got any advice for hairdressers on that?
Yeah, really important for any form of hair loss. Either encourage your client to discuss this with their GP, because this could be an indicator for a serious underlying health condition. And the client might be embarrassed to bother their GP about this, but encourage them to go and talk to their doctor and go and see a trichologist. Obviously, Nick, if someone's undergoing chemotherapy, then they'd really benefit, as would anybody with hair loss issues, from seeing you guys at Banbury Postiche. A really good replacement hairpiece can really help someone feel good about themselves. And many people don't realise how good some of these wigs and hairpieces really are now.
Yeah, definitely. Yeah. I mean, even one of my family members, she was just suffering from some thinning hair, and we sorted her with a piece, and the difference in confidence and look was just unbelievable. It can make a real mental difference to someone, can't it? When you give them that look that they're looking for or hope to have. So what resources are available for hairdressers? I mean, it's a bit of a minefield out there, I guess, trying to get the right information and to learn more about hair loss and some of the solutions.
Well, now there's many registered professional organisations that now offer trichology training within the UK. If a hairdresser is genuinely interested in learning more about trichology, then an online search will give you any number of trichological institutions to choose from. If as a hairdresser there's a trichologist in your area that you admire, then reach out to them and ask them for their advice. Ask them who you should go to learn more. For myself, I trained with the Institute of Trichologists, and my partner here at the clinic, who can't be with us today, she trained with a company called TrichoCare. Both of them run courses in trichology, which give the hairdresser enough knowledge and insight into some of the most commonly seen hair loss issues. Gaining that knowledge would be a real benefit for both the client, the hairdresser, and the salon where they work. And if as a hairdresser you enjoy this, you may wish to go on and study further and gain your qualifications in trichology. Brilliant.
That's really good advice. Yeah, I mean, the more knowledge you have on this subject, it can only be a good thing, can't it, from a hairdresser's point of view. We've got some questions from people who have logged in. One of them says, my son is 22 and suffering hair loss after trauma and wants a transplant. Any advice? I mean, that's quite a drastic thing, I guess, a transplant.
It is. It's going to depend on a lot of things. So obviously, without seeing your son, I can't comment on his exact condition. So I'll try and offer some good nuggets of advice. First of all, from my point of view, I wouldn't advise going abroad. We're seeing a lot of medical procedures, eyes, teeth, hair being done abroad at the moment. And although they are cut price, and for some people it can work, but for every person who has a good result, we're seeing in our clinic someone who doesn't have a good result, who has a bad result with hair transplant surgery. They then have to go and have that put right, and the money they saved having it done abroad, they're spending double that amount having it put right here, as well as all the trauma of going through it. So do your research, find a really good hair surgeon artiste, because the transplant surgery now, it's a real beautiful artistic expression that the hair is put in the right manner, at the right angle, in the right place. It's beautiful to look at. Maybe I'm just a bit weird, I find it so. But as trichologists, we do refer to specific hair surgeons. We have a clinic we work with, and we know individually the people in that clinic. So when I've got someone sitting in front of me, we may actually send that person to a particular surgeon in a particular clinic, because we know that they're so good at doing what that person needs. Last bit of advice though, be prepared to be knocked back. Be prepared. Sometimes there are some things that can't be put right with hair transplant surgery, and no ethical surgeon in this country would work on someone for whom the results now or long term aren't going to benefit them. So occasionally as trichologists, we see someone who wants a referral and we have to say, I'm really sorry, but in your case, surgery will not be a good thing. It won't work for you. And there are specific reasons for that.
Brilliant. Thank you for that, Neil. I mean, obviously the first protocol will be the trichologist, and they can go on from there and take their advice. This is a good one. Are there any products that will realistically help encourage growth and strengthen new hair?
Yes, there are. It does depend on what we mean by the question. Obviously, recently in salons, there's been a boom in different bond builders, repairers. A really close friend of mine looked into that for me a few years ago, a chemist, and he couldn't conclusively say whether these bond repairers were doing the work that they said they were or not. All they could say after lots and lots of looking into it and investigation was that it did something to the hair, and what it did seemed to benefit the hair. Mm-hmm. So that's about strengthening the hair shafts that are there. Strengthening hair that's growing, then maybe if someone has a deficiency, then supplementation can help, but it's best to know if they have a deficiency from blood tests, etc. first, before loading up on lots of supplements that may not be necessary. Obviously, good diet, exercise, drinking lots of water is really good. And then as far as products are concerned, then something that actually sort of penetrates, doesn't just go onto the surface of the skin, but something that goes down into the hair follicle and the bulb and activates the cell production in this area. That's what's going to give us over time stronger and thicker hair through here. And as far as I'm concerned, what we're looking at there is products that have what we call APIs, or active pharmaceutical ingredients. So we're looking at forms of medication that are topical and have proven results, rather than lots of online stuff about massaging different oils into your scalp that may or may not. You know, my friend massaged olive oil on and her scalp got thicker and her hair got better. You know, there are lots of false information or coincidental information. So again, it's good to do some research and find out from someone who knows, a trichologist, who can recommend actual products with proven results.
Would that be an example, being something like minoxidil, something like that?
Yeah, minoxidil is your over-the-counter version that you could get directly from the pharmacy, and then there are other variations of that that are more specialised and, should we say, bespoke to someone's DNA, someone's receptors within their body. So it's always worth meeting one of us guys who can give you advice on that. But yeah, minoxidil.
Yeah, I mean, here at Banbury, we use nioxin as a cleanser, if you like, to make sure the scalp's in optimum shape to receive new hair growth, so the pores are clean and the blood flow is maximised as much as it can. I mean, would you agree with that, that Nioxin can set the scene, as it were?
Yes, I think it's really important to have a really good shampoo that's actually produced from a dermatological point of view. So a shampoo that is focusing on healthy scalp. And that in its own isn't going to reverse any form of hair loss, but it's going to get the scalp in the optimum, as you said, Nick, condition, the optimum environment to encourage hair growth. But also, if you're using a topical solution that's an active pharmaceutical ingredient solution, you need a good cleanser, and the scalp needs to be really clean for that to be able to penetrate down to the follicle area. If there's a lot of dead skin cells on the surface, that acts as a sponge. So your topical solution is being soaked up by the dead skin cells on the surface. We've got to get that clean in order to encourage the solution to go down into that area. So shampoo is really important, and it's a really good start.
Brilliant. Great. Thank you for that. That's been really informative, Neil. Thank you for your time today from away from your clinic. I don't see any other questions there, unless Sophie's going to come in with something. So yes, thank you again. It's been really helpful. I hope people have enjoyed it and found the information useful. And thank you, and we'll see you soon.
Great. It's been a pleasure, Nick. Thanks for inviting me, and thank you for everybody listening in. Thank you very much.
Cheers.